Thank you for joining us today for this overview of braiding and blending funds as a tool to promote social determinants of health. I'm Stuart Butler. I'm a senior fellow at the Brookings Institution here in Washington. And I'm joined today by Mary Ellen Wiggins of the Forum for Youth Investment and Kathy Stack of Stack Consulting, both of whom have many years of experience in government budgeting and evaluation. And also Len Nichols of the Urban Institute, who has advised government at all levels on collaborative health approaches. Now, when we think of many areas of health, from children's mental health to aging, we know success depends on effective collaboration across different sectors such as housing, healthcare, social services, even law enforcement. And effective collaboration usually requires financial resources to be coordinated as well in some way. But there are many obstacles to achieving collaboration in funding. For one thing, managers typically are judged on how they use funds for their department's programs, not for sharing funds with other departments. Also, even if collaboration is valued, local managers worry that mixing funds may breach specific program rules, especially if federal funds are involved. There are also other barriers to collaborative funding across sectors. Different data systems exist in different programs, and that can make collaboration very difficult. Privacy concerns arise. There can be departmental and institutional cultures that just get in the way of working together. And to add to all of this is the so-called wrong pocket problem. A wrong pocket problem arises when one organization, sector, or department is best placed to make an investment, but it's another sector or another pocket that benefits from that investment. And if a sector or department incurs the cost, but can't capture at least some of the generated value or savings, there will be a reluctance to spend money, and there will be underinvestment in collaboration. Let me give you a quick example. Let's say a housing department in a city was considering spending a lot of money on improving housing for elderly residents by doing things like making bathrooms safer, doing a lot of construction work of that kind. And the result of that is that there are fewer falls by elderly residents, meaning, of course, fewer trips to the hospital, much less money spent on orthopedic surgery and recuperation and so forth. Well, the housing department puts up all the money, but its other programs, Medicare, Medicaid, private insurance perhaps, that actually gets the return on that investment. So understandably, housing managers are hard put to justify, in many cases, spending that kind of money. That's an example of the wrong pocket problem. So given that, we need to find ways to address these barriers and mix money together more effectively to achieve agreed goals. Well, there are broadly two ways that we can combine funds. The first is what we call braiding. That's when funds from different programs or other sources are coordinated to reach a goal. The key point in braiding is that each stream of funds is tracked separately and evaluated separately by the original funding source, and the user has to report back to each of those sources on exactly how the money was spent. Braiding is the most common way of combining funds. In the blending of funds, by contrast, money from different sources is literally pooled together and both managed and tracked as a single pool of money. But how in practice can braiding and blending actually be achieved? Well, in a number of ways. So let me now hand over to Mary Ellen Wiggins, who will describe a variety of approaches that can be taken.
Awesome. Thank you so much, Stuart. All right, so we're going to start off with things that you can do administratively to make a difference with braiding and blending. So when it comes to administrative actions, oftentimes people's first thought is, well, what's federal or what's state or what's local or what should a tribal agency do? And honestly, when it comes to doing this kind of work, while it can play out differently at different levels of government, there are a few common strategies that can really make a big difference across levels of government, no matter where you represent. So again, they may look a little bit different in practice, but the concepts are often more similar than different. So we're going to talk about them at that bigger strategic level. So the very first thing that we're going to talk about before we get to anything on the slide here is, well, wait a minute, before I start doing anything, how do I know when I have a problem where I might need to take an administrative action? Well, honestly, the areas of tension are usually not mysteries, even if we don't quite know what to do about them yet. So if you're wondering, what are some of the areas where people might be trying to braid or blend and they're having a hard time, listen to your grantees, your partner organizations and implementation, the clients and the families that you work with. What are the rubs that they're feeling? Where do things seem difficult and they could come together better to have a better outcome? So looking for those sticky intersections with other programs that sometimes everyone just kind of shakes their head at, that's a really great place to get started. And then the very next thing that you should do is, of course, decide to do something about it. I know sometimes when we get into braiding and blending, people feel like, oh my goodness, we're getting into really big issues where it's so hard. I'm not in a position to fix it, or the larger system is just broken. But one of the best things you can do is just decide to take action. So here are some of the specific strategies that you can use to help make a difference. So number one is fostering cross-agency collaboration. So what that can look like is collaborating with the very issues where it gets kind of sticky about who owns the issue or there's some tension. So maybe that's across public health and public safety, or workforce and education, health and housing. Go find those people in other programs. Maybe you know them already from meetings or from things that you've heard, and look for ways that you can do something together. Or if you don't work in one of those agencies, maybe you can create a convening space to help bring people together. So another strategy that's just the more formalized version of collaboration is coordinating bodies. So coordinating bodies have a clear purpose with roles and responsibilities for helping the different pieces fit together. So a couple of examples up here on our slide: state and local children's cabinets, which bring together the many different agencies and sector stakeholders who are trying to help kids and families through a piece of their lives to have a shared vision, goals, and outcome measures. Another example at the federal level is the U.S. Interagency Council on Homelessness, which brings together a total of 19 federal agencies to coordinate and collaborate on strategies to end homelessness. So coordinating bodies are a great strategy. Some things that you can do through those mechanisms include coming up with common language for grants or common priorities, referencing each other's programs and describing how they can work together, putting out joint guidance, or just holding office hours so that grantees can come to you, ask questions, and better understand how to work together so that they can feel confident about what they can do. Often, that's just myth busting, which brings us to our next strategy, providing clarification and safe harbors. So if you want a few examples, there's some here on the slide. The federal level, there's a great Medicaid disaster response toolkit. The state of California has some really great guidance about reopening public schools that involves working across sectors. And of course, Broward County, Florida, their Children's Services Council has some really great invoicing guidelines that address some of the really practical needs that arose suddenly under the coronavirus. All great examples of how to make things clear. So think about, are you writing your rules in really plain language? Are you giving examples? Sometimes these things that seem small can make a really big difference, especially if you work in a program like Medicaid, where there are lots of dollars at stake. So think about how you can help a small knit in your area not be the holdup so that people can do great things that are allowable and make sense. So some other strategies are seeking and or agreeing to waivers, which can be blanket for everyone who participates in a particular program or receives a particular kind of grant, or individual. A couple of great resources here are in the Medicaid program, waivers to states that allow for innovation and experimentation. The Food and Nutrition Service has offered a ton of waivers during the COVID-19 crisis that have been incredibly helpful to making sure that kids and families have access to the food that they need, both through blanket and individual waivers, sometimes that states need to opt into. Also think about whether there are specific requirements that you can ease, such as a reporting requirement that's burdensome or a licensing requirement that doesn't really make sense. So those are some really great administrative actions. Now let's move on to the next slide, where we can talk a little bit about capacity. So capacity plays a major role in really driving change for blending and braiding. There's no way around it. It just takes some level of person power to braid and to blend effectively. So while you can have a clear impact through targeted flexibilities, through clarifications, through the technical assistance that we talked about on the last slide, for bigger systems level changes, it does take some more capacity. So some ways to get at that are special bodies, like the coordinating bodies that we talked about on the last slide. And of course, if you can pair those with some dedicated funding or special legislative authorities, which we'll get into more later, then you can really have an impact. So up here on the slide, we just have a few examples to help think through what that can look like. Of course, we talked about the U.S. Interagency Council on Homelessness on the last slide as they coordinate and catalyze the federal response to homelessness. Again, working across 19 different agencies at the federal level, so pretty big. Another good example, the Interagency Working Group on Youth Programs. So while the Interagency Council on Homelessness was established in statute, the Working Group on Youth Programs is actually set up by an executive order. So there are a few different ways you can get to these things. The Working Group on Youth Programs is made up of 21 different federal departments. So again, you can really do these things at a large scale. As we get into the state and the county and the local capacity drivers and special coordinating bodies, you'll see that we also start talking more about funds. So for example, children's cabinets, which we discussed on the last slide, can be really helped by having funds that they can use and they can distribute to help do joint projects and actually bring together those dollars in a blended or braided way. The Virginia Children's Services Act is a really great example of that. Local wellness funds also get into providing that capacity, providing that mechanism to bring dollars together from different sectors and different players. So with that, I'll hand it over to Len to talk about the wrong pockets problem.
Thanks, Mary Ellen. As Stuart said at the beginning, the wrong pocket problem essentially arises from the fact that one person's actions benefits other people. And in general, wrong pockets can benefit many people at the same time. And that's really why I think the first fundamental precondition of achieving solutions here is for those stakeholders in a local area to recognize their mutual self-interest. That is to say, think about housing, think about permanent supportive housing in particular, and how that will surely benefit the people who were formerly homeless. It will enable them to function better, to have better health, to have better well-being, and to be better citizens in the communities in which they live, and thereby strengthen those communities. But it could also, in fact, very likely will lead to a reduction in unnecessary utilization in healthcare and therefore savings to insurers or hospitals or even City Hall when they have to spend less effort finding people solutions when they don't have a house to call their own. So there are these mutual self-interest realities, but that recognition of it is a precondition to having what we would call an adult conversation about this stuff. Now, just recognizing the self-interest is the start. It's not enough. You're probably going to have to understand how to share enough data so that, in essence, you trust but verify. You've got to prove impact. And to prove that impact, you may very well need to create a kind of a third party that might take some proprietary data from one stakeholder and combine it with data from another and help each of them see that they are indeed benefiting from the intervention or from the activity upstream to solve a social determinant of health problem. But they're going to have to see that in their own data and in their own data systems. And so there probably is going to need to be arrangements, some of which are facilitated by the kinds of institutions Mary Ellen just talked about, to enable data sharing across different entities so that they all can, again, trust but verify what's really going on. Now, I have to say, I'm an economist, so to me, everything looks like a nail. Well, you want to think about incentives, right? You have the hammer of incentives you can use. Well, there's been a lot of creative work in the last few years, and I have to give the Trump administration and Seema Verma high marks here on being more, I would say, open to and creative about enabling Medicaid managed care organizations as well as Medicare Advantage plans who serve Medicare beneficiaries, of course, allowing them more freedom to spend some of their program dollars, what we call upstream, right? Addressing these social determinants of health. Both of them are now able to do some things in food, to do some things in sort of supportive housing and some other interventions, all of which are in transportation, all of which are highly beneficial to multiple stakeholders downstream, in addition to being helpful for the patients and clients, of course, themselves. But I would say those payment rules that have changed are steps in the right direction, but we need to go much further. And that's really why the evolution of these new models to foster collaborative work on the ground or joint ventures have taken on a kind of a life of their own. The one that's best known is known in the United States as Pay for Success. It came out of the social impact bond thinking in Great Britain. But the idea behind Pay for Success is, look, we all know that governments are constrained. We all know that there's been some, shall we say, across the board loss of faith of government capacity to deliver on various interventions, and government budgets are strapped because of that. And so what's often true is there's an intervention that might actually lead to all these mutually beneficial activities I'm describing, but there's no money to do it in the short run. Well, private capital has begun to step into this breach. And this is an exciting development for all of us in this field, because it enables money to come in from outside and be tied specifically to a particular intervention which the stakeholders of the local area will execute. And they have to believe this is going to work. They have to believe that it will generate some kind of financial ROI. But the payback to the private investor only happens if the project achieves success. That is, if you house the homeless, if you indeed reduce the utilization that you anticipate, et cetera. And so the Pay for Success model is one that is very attractive analytically to a lot of people. It is spreading now around the country. I will say it has not been taken up as much as the logic would suggest it should have been. And part of that is there are lots of reasons for that, but the disconnect between the complexity of working out the contractual language and showing the actual benefit that's likely to occur. There's a lot of issues around it, but it definitely is a great example, and a wonderful recent example is right here in the District of Columbia, where a private investor, a private health plan, and the DC Medicaid program all agreed to create a respite care program that would be financed, in essence, by the health plan under the auspices of the Medicaid program, if indeed the success that's targeted and believed to be achievable occurs, and the private money's at risk until that happens. And that's a very nice solution. Another model is one that I and my co-author Lauren Taylor, who's now at NYU, developed a couple of years ago, and it's what we call CAPG, Collaborative Approach to Public Good Investments. We call all these things that benefit multiple people downstream public goods. And what we've observed is that public goods in general are underinvested in precisely because of the wrong pocket problem. There are lots of ways to describe it, but that wrong pocket problem leads to each individual stakeholder typically feeling like they can never get their full investment return back. And so there's a gross underinvestment across the country. It doesn't take a rocket scientist to see that gross underinvestment in our social determinant areas in virtually every place in the United States. So what we came up with was a way to solve the wrong pocket problem, or what's sometimes called the free rider problem. And this CAPG process is what does it. Now you can get more detail from the last slide, which will show you the link to our website and the papers we've written and what's going on. I'll just say the fundamental essence of it is that instead of the Pay for Success model of relying on private capital to come in from outside and then take a return out of the community, the collaborative approach to public good investment depends upon local stakeholder funds. It depends upon that local stakeholder recognition of mutual self-interest. And somebody playing the role of a trusted broker could be a United Way, it could be a trusted health information exchange, it could be a civic group, an employer group, lots of different forms around the country. In fact, we have a project where 10 sites are pursuing our model in various speeds. COVID obviously slowed it down, but both Cleveland and now Waco have agreed to move forward in using this model. Cleveland's using it for medically tailored meals. Waco's using it for addressing people having extreme behavioral issues to avoid being arrested or avoid going to ED, both of which are highly expensive and unproductive outcomes, and instead get folks the mental health and complex case management they need right away. So there are different ways to solve this wrong pocket problem. I think it's fair to say we need all of the above. Not every solution is optimal for every community. Our country's large and diverse, as you all know. But fundamentally, there has been a lot of progress, and I look forward to learning about more. And Kathy Stack is now going to talk about what some of the things going on in the federal government and on Capitol Hill to make solutions easier to achieve. So Kathy.
Thanks very much, Len. So I'm going to talk about some things that have happened in Congress. I haven't worked in Congress, but I've been watching these with great interest. So I think there's a recognition that even though the silos that frustrate us all emanate from Congress, Congress is also now sensitive to some of the problems and the barriers that have been created and is trying to address them. So walking through some highlights, back in 2014 in the appropriations bill, Congress, the appropriators for the labor HHS education appropriation, accepted an Obama administration proposal to create performance partnership pilots for disconnected youth. And since that went into place in 2014, it's continued and it's even been expanded so that now youth programs in DOJ and HUD are also participants in this. The authority allows for up to 10 pilots per year for state and local governments who bring forward to the federal government a plan to blend money and receive waivers that would improve education, employment, and other well-being outcomes for at-risk youth. It's been complicated to administer, but the agencies have together learned a lot. And one of the most important insights that they gained was that many, if not the majority of proposals that were coming forward from state and local governments were seeking flexibility to integrate programs using approaches that states and localities thought they weren't allowed to do, but in fact they are. And it just shows how much myth has now penetrated every level of government in terms of the apparent lack of flexibility, when in fact there's an awful lot that can be done, particularly with braided funding models. So another example is the Social Impact Partnerships to Pay for Results Act. This was enacted in February of 2018. It's a Treasury program that deals with the wrong pockets problem that Len was describing. The law provided $100 million for Treasury to administer in collaboration with other federal agencies that run social programs. And most of the money would be available for making outcome payments on the back end if there are successful projects, as well as financing the evaluations. The projects to be eligible, a state and local government must demonstrate that the projects would result in measurable outcomes that result in social benefits and government savings. And while ideally those savings would happen at every level of government, there must be some federal savings as well. The first round of grants we had hoped would be made by now. Unfortunately, with COVID, some of the activity was sort of put on hold. But the finalists for the first round of grants were actually announced last fall. And they involve, some of the examples are projects that would reduce homelessness, projects that would reduce youth violence, and projects that would reduce maternal and child health, or improve maternal and child health, excuse me. And in every case, the applicants were able to show there was rigorous evaluation research that showed there was very significant chance of impact, and also government savings. So moving on from that, last year, the Social Determinants Accelerator Act was introduced on a bipartisan basis in both the House and the Senate. It's not a big bill, but it acknowledges that we need to have a very proactive effort from the federal level to encourage more collaboration between the healthcare sector and social services that can do upstream prevention on food insecurity, transportation, childcare, job training, housing, things like that. So the bill would provide $25 million, most of which would go to state and local governments that are developing really promising social determinant accelerator plans. The plans have to identify with community members, stakeholders, multiple agencies, a high need population, an effective or promising intervention that's backed by research, measurable health and social outcomes, a strategy for integrating data, for targeting services, coordinating care, doing the evaluation, and also have a rigorous evaluation plan so that at the end of the day, if this plan is implemented, there'll be an ability to say, did it work, and is it something other communities should consider? The bill has not passed either the House or the Senate. However, the House appropriators in their 2021 appropriations bill that is now pending took some major elements and incorporated them in the appropriations bill. So it would provide $10 million for CDC grants to fund pilots, and it would also direct the HHS secretary to establish an interagency council whose job would be to assist state and local governments understand all the flexibilities that they can take advantage of in order to braid and integrate health and social services for these social determinants accelerator plans. There's other payment flexibility legislation. One example is Medicare Advantage, which recently expanded the flexibility to provide personal supports that would allow elderly individuals to live independently and live healthy lives. There's a bunch of things that Congress could do going forward that don't have to cost money. And I'm just going to blue sky, for example, in program authorizations, so often there is a sense that if an activity isn't listed specifically in the law, that it's not eligible. Congressional authorizers could easily write some standard language that allows some flexibility in what activities can be supported, provided there is evidence that they will produce the outcomes that are intended for that program. In addition, appropriators, they could take the same strategy that's used in the Social Determinants Accelerator bill and direct federal agencies to set up coordinated technical assistance that works across agencies to ensure that grantees understand the full range of flexibilities that are available to them and how they could seek waivers from multiple agencies simultaneously in order to make something work. So I think what we've learned from some of these other pieces of legislation is that the most important way to get a Congress's attention is for constituents to come forward with common sense, innovative, cross-sector approaches where why wouldn't we want these things to be allowed? And I think Congress, when they see those real examples, then feels an obligation to say, what can we do? And it often doesn't have to really involve any new money. It's just simply granting flexibility to use existing funds more effectively. So with that, I will turn it back to Stuart.
Thank you very much, Kathy, and thank you for viewing this webinar. As I think we've shown, what seems to be the simple idea of saying, why can't all these different organizations and programs work together for common goals? It turns out to be a complicated and challenging issue. But I think we've also shown that there are many very developed approaches that are available already, and that there are many more in the pipeline. So we should be very confident, I think, that these issues that get in the way of collaboration are gradually being addressed, and there are a lot of opportunities right now for moving forward. If you'd like some more information, you can reach me or any of the other presenters at these email addresses. And also, if you're looking for more information generally on the issue of braiding and blending, here are some links to sites that you can have a look at and see a lot of different publications and events and examples at all levels of government. So we hope that this overview of techniques to achieve braiding and blending has been helpful. And thank you again for viewing the webinar.